And they tried that, and they would encourage, and they might meet. They met in the morning, and they'd look, and they'd say, so here are some people that you potentially could refer. But at the end of the day, the physician said, I got busy, I got distracted, they had these other issues, and so I only referred 20% of who I thought would have been appropriate, And so instead, then, the assistant said, well, how can I help? How about if when we identify them in the morning, then I will attach the referral form to their chart to trigger you that is something that you're considering. And so they tried that, and it worked much better. Another example was for self-management. They were referring clients and patients into the Stanford Self-Management Program, but then somebody did a test of change and said, we also have this other frustration because we have wait times for rehab. So the rehab group actually said, we're going to phone patients who are on our wait list and say, you're still on our wait list, but maybe you'll be happier and you won't phone us back so much to ask about the wait list if we give you something to do, while you're waiting. So they referred them into the self-management program. And wouldn't you know that a significant number of patients removed themselves from the wait list after participating in the self-management program? So another example is in Pincher Creek. So Pincher Creek actually is a very broad rural community, and they have a satellite clinic serving the blood tribe. They have interdisciplinary focus, and so they have a more centralized team within their group that supports the complex patients that come through the door. Another example actually in Alberta is Fort McMurray, who have another central team, but that one, what they recognize, and I'll just move you ahead in this, I just wanted to show they have an integrated program team because they have, you don't have that picture, but it's just to illustrate that there are 20 solo practices. How do you support integrated teams when you have 20 solo practices? And that was when they started. They lost 6, 7 physicians very quickly, so they were in a bit of a desperate situation. So they had to figure out how to build a team that was going to support that. So in fact, they created the centralized program. Physicians were invited to refer in. They did a lot of team building events, but they also started to recognize that there has to be that two-way dialogue. So now the yellow arrow is showing that now they're starting to move some of their clinicians temporarily to go into the clinics and do some of that population-based planning and intervention to help them one step ahead. So this is a generalist team example where they were looking at the operation of the system. And this is actually an example from the QUIP Collaborative in Ontario. This is New Vision in Kitchener. So they decided to take a look at the weekly schedule that was upcoming for the physician and to look at what were the unnecessary appointment bookings. Were there any where they could think of other ways that could serve the needs that were being presented, maybe by using the allied health team or making sure that the testing was done prior to the visit so that the visit was made more effective, and following up on those pieces. So in looking at their general system and looking ahead, what do we see coming and how could we improve what's coming and implementing some of those changes, then they actually improved their access by 57%. And so this is just from June to August. They went from 13.5-day typical wait time to third next available, which is the way that we measure access, to 5.8 days. So that's an example. Now that team, that was led actually by the receptionist who said, oh, I get these concepts. You know what? I can help lead this. They didn't take it over. The receptionist didn't own it solely, but the receptionist became a champion of saying, I can help us move this forward. So the lessons learned are to follow the basics of improvement science, get leadership and buy-in with the organizational strategies and goals, focus on the work that's coming in and supporting the care across that patient's whole clinical experience and the whole clinic experience. Develop clear objectives. Real-time measures are very important data, not just final outcome measures, but how are we doing this week compared to next week compared to last week? You know, you have to be thinking at that level. Break down changes into bite-sized chunks, test and learn them together. So now the typical view that we see of teams that have started to implement this is that within the family practice, there are far fewer walls, there's way more consistency, there's each provider, whether it's physician or nurse practitioner, still needs to understand their particular roster, but is being served by the whole general practice to meet the needs of that roster. They are referring their most complex and getting support and consultation from specialty programs in a way that's consistent and reliable, far less rework, and they are accessing community health support programs with the recognition that chronic care is about decisions every single day, and the health system is not meant to create a system that deals with people every single day. That's our community. So this is your chance to look up, unlike these poor fellows, who are really struggling, pulling this wagon, when if only they stopped for a moment and changed the wheels, they would be able to move so much faster. But the trick is you do have to look up and stop and invest in changing the wheels in order to get the traction that you want to get. So where to next? Your family health team are your resource. The answer is within you. We know that, and you've already shown lots of successes, but it's working with that internal team to say, let's look at our quality, let's form a quality improvement team. There are resources out there. Our website has a host of resources, not only on the current status of the health system and how it's performing, but for quality improvement on the concepts, the tools that could be useful to you. And look for structured support opportunities, whether that is QUIP or yesterday we heard about G2C. Those opportunities are gold. They are absolute gold. And a number of teams have approached me. I've been involved with 8 collaboratives in Alberta and now 3 here in Ontario. And there's always the question about, well, we're not sure that the time is right for us because we're just changing our information system now, or we're just about to co-locate, or new providers are going to come on in a month. And those teams that didn't wait, those teams that forged ahead, always have consistently said what we learned in this collaborative helped us to adapt to the rest of the changes far more effectively and helped us make sure that we were not just strengthening an old way of doing things. And so they have all said that it was fabulous to do these structured opportunities earlier rather than later. And so I would encourage you to consider how you can use that. Thank you so much.